Hey everyone, I'm back again with another lung sound. Let's talk about coarse crackles today. A classic sign of something wet or obstructive is happening in lower airways. Coarse crackles are loud, low pitched, gurgling, or bubbling sounds. Think of air moving through fluid secretions or mucus. They usually shows up on inspiration, but you can also hear it on expiration too. It often change or partially clear with coughing because secretions shift. It happens in pneumonia, COPD, pulmonary edema, or in patients who are not mobilizing well. If you hear coarse crackle, we need to assess for productive cough, increased work of breathing, or decreased SpO2 level. Follow for more.